If your quad feels weak, the answer is not always try harder. Sometimes the answer is train smarter, and oftentimes that's the answer. Are you ready to get back to what you love after knee replacement? The Total Knee Success Podcast is your trusted guide with practical tips, evidence-based strategies, and no fluff. It's not personal medical advice, just solid education to help you manage pain, regain mobility, and get back to living the life you love. Let's dive in. Welcome back to the Total Knee Success Podcast. I'm Michelle. This is the second episode in our 4-part Prehab series, What to Do Before You Have Knee Replacement Surgery. If you want to go through the full series in order, I would start with episode 79 first. In episode 79, we talked about knee stiffness, range, swelling patterns, and the daily habits that can make your knee easier to work with after surgery. Today, we're moving into the second theme that shows up in almost every prehab conversation I have, and that's quad weakness. Your quadriceps are the large muscles in the front of your thigh. They help straighten your knee, control your knee as you lower down, and support you in the moments that tend to expose weakness fast, getting up from a chair, taking a step, and going down the stairs. By the end of this episode, you'll have a clearer understanding of why quad weakness is so common before surgery, why it tends to show up early after surgery, and what kinds of prehab choices often translate into a stronger start. Most people don't walk into my clinic saying, my quads are weak. What usually happens is I see it in the testing. It shows up in something like a 30-second chair stand, a step task, or a direct strength screen where the quad just isn't giving what it should. Once we see that, the next question is whether you're dealing with a true loss of muscle capacity, meaning less muscle mass and less force available, or whether it's more of a nervous system problem where the quad isn't being recruited well when you try to use it. Sometimes it's both. And that's one reason pre-op physical therapy can be so helpful, because it helps you train the right problem. If you've lived with knee pain for a long time, your body adapts. You stand with less load on your painful side. You shorten your stride. You use the other leg to push up from chairs. You avoid stairs when you can. These are normal adaptations to pain. Do any of them sound familiar to you? Your body is trying to protect you. Over time, those patterns can reduce strength and also change activation, which is the ability to recruit the muscle fully. That means your quad isn't getting the same repeated loading and full range work that it used to. The muscle can lose capacity, and your nervous system can also get used to holding back. So even when you try to fire your quad, you don't get a full contraction the way you expect. Now layer in swelling. Fluid and tissue pressure inside and around your knee can make the capsule tighter and more sensitive. That same pressure can also change the signals your nervous system sends to your quad. This is one reason swelling and pain can reduce how strongly your quad contracts, even when you're trying hard to get it to contract. Here's the context that makes this next step more effective. If your quad feels weak, the answer is not always try harder. Sometimes the answer is train smarter, and oftentimes that's the answer. Let's use the same made-up example from episode 79. Someone we'll call Megan. She isn't a real person, but she reflects what a lot of people describe before knee replacement surgery. Megan has a surgery date on the calendar. Her knee is stiff at the start of the day, and her knee swells by evening. When she stands from a chair, she leans to the opposite side and pushes off her arms. She avoids stairs, and when she has to do stairs, she pulls up with a good leg and follows with the leg she's about to have surgery on. She tells herself she's out of shape. In reality, her quad has been living under a protective set of rules for a long time. One reason this is worth addressing before surgery is that the quad strength before surgery is linked to function afterward. In a study that followed people through total knee replacement, preoperative quadriceps strength played a major role in predicting functional performance a year later on tasks like stair climbing and timed up-and-go testing. That doesn't mean your future is decided by one number. It means quad strength is one of the levers you can work on ahead of time. There's another reason the quad deserves attention, and that's what happens right after surgery. Classic research shows that quadriceps strength drops sharply early after surgery, and a big part of that early loss comes from reduced voluntary activation. Not only muscle size changes. You can be motivated and still feel like your quad is not responding. So prehab for weak quads is not about getting a perfect strength score before surgery. It's about giving your quad as much capacity and as much activation practice as possible so the early phase is easier to navigate. There's also evidence that prehab can help in the early window after surgery. Across studies, prehab programs tend to show the most consistent benefit before surgery and into the first few months after, which is when strength, walking, and stairs can feel most demanding. That's why this series is focused on what shows up early. What changes when you train your quad with knee pain in the background is how your body responds in the moment. If Megan does a classic seated knee extension, which is just kicking your leg out, and it hurts, she may tense up, cut the set short, or unconsciously shift the motion a little bit, maybe use a little momentum just to get through it. If she does a squat and her knee swells more that night, she might back off the next time, which is understandable. If she does a step up and her knee feels unstable, she stops trusting her leg. This is where a lot of people assume their quad is weak because they are not tough enough. And that's really not what's happening. When pain and swelling are present, the nervous system can create an activation deficit, sometimes called arthrogenic muscle inhibition. The quad is not just weak, it's inhibited, and that's your body protecting yourself. That doesn't mean you can't train it. It means you may need a plan that works with that reality. So what does that look like in prehab? First, you train quad strength in positions your knee can tolerate. For some people, that starts with isometrics, pushing without movement. For some people, that starts with a partial range. And for some people, that starts with more hip-dominant work that still load the leg. The goal is not to avoid knee work at all. The goal is to build a bridge from what your knee tolerates now to what you will need after surgery. A lot of quad prehab ends up looking like a few simple building blocks. Quad sets and short arc quads help you practice turning the muscle on without provoking the joint too much. If you tolerate more, straight leg raises or a small amount of knee extension work can build strength through a limited range. Then you carry that into a functional drill like supported sit to stand or a small step up, where your quad learns to do the job it will be asked to do after surgery, or with function in general. This is a great place to work with your physical therapist because they can help you pick the right exercises, adjust the range, and make sure you're getting a real quad contraction without flaring up your knee. If you're looking for additional education, I'll be publishing a prehab handbook soon called the Knee Replacement Game Plan. Stay tuned, and if you want to be notified when it's ready, sign up on TotalKneeSuccess.com. Second, you train activation on purpose. This is where people often miss the mark. They do the reps, but they never practice the skill of turning the quad on. And that skill is important for walking, for getting up from chairs, and for keeping your knee from feeling like it's buckling when you're tired. But this can be challenging. This is also where neuromuscular electrical stimulation, NMES, fits into the conversation for some people. And let's be clear about what the evidence base is here. Most of the research support for NMES in knee replacement is after surgery, when the quad can struggle to turn on, and early strength drops are common. When NMES is started early after surgery and used at a meaningful intensity, studies suggest it can help improve early quad strength and early function. Before surgery, the evidence base is smaller, but there are two reasons some people and their therapists consider using NMES in prehab. There may be more, but I'm going to cover two of them here. It's in the activation. If your quad activation is poor, NMES can help you practice producing a stronger contraction than you're getting on your own, which can make your strengthening work more productive. The second is familiarity. If your therapist plans to use NMES after surgery, learning the setup before surgery can make it easier later because you already know what it feels like, where the electrodes go, and what a real contraction should feel like. NMES tends to work best when it's used often enough and at a dose that actually creates a strong contraction. And that can be hard to accomplish if the only time you use it is during occasional clinic visits. That's why a home unit can be a viable option for some people, as long as you're using it properly and following a plan that your therapist recommends. The best path is to learn it with your therapist first, confirm it's appropriate for you, and get clear instructions for placement, intensity, and how often they want you to use it. NMES isn't appropriate for everyone and can be dangerous in some cases, so make sure your therapist or provider clears it based on your medical history and any implanted devices. If your therapist recommends a home unit, and helps you choose the right setup, I do have an option in my Amazon store, and I'll link that in the show notes. If you purchase through that link, I may earn a small commission at no additional cost to you. It helps support these podcast episodes, so thank you. Third, you connect your quad work to the movements that will show up right away after surgery. That's getting up from a chair with less reliance on your other leg, stepping up with control, and practicing the lowering part of a step or sit down so your quad learns to handle the work instead of avoiding it. You're not training for performance, really. You're building familiarity with these exact patterns that tend to be hardest early on. Later on, you can train for performance. And even though this episode is focused on your quad, it helps to remember that your quad does not work alone. Your hip muscles, especially the glutes and hip abductors on the side of your hip, help control how your leg lines up when you stand and walk. Your calf muscles help with push-off and with controlling lowering when you go down a step. When those muscles are undertrained, your quad has to do more of the job, and your knee can feel less stable. In prehab, it's often useful to include a few exercises that strengthen the hip and calf alongside quad work, so your whole leg is supporting you, not just one muscle group. And this is where Megan changes her story. Instead of thinking I'm out of shape, she starts thinking my quad is undertrained and underused, and I can work on that. She starts with a few sessions a week that focus on strength and activation, and she puts the work earlier in the day when her knee is less swollen. She keeps the sessions short enough that her knee does not swell and make the rest of her day harder. She practices getting up from a chair with more symmetry. She practices a small step up with support and pays attention to her quad doing the work. Over a few weeks, her knee is not magically pain-free, but her leg starts feeling a little more dependable. That's what reassures Megan because she can feel her leg starting to cooperate again. There's another important point here for weak quads. People often think prehab strength has to be heavy to count. It does not. The best plan is the plan that you can actually do. If your knee tolerates heavier training, great. If it does not, you can still build strength through consistent effort, appropriate load, and enough weeks of practice. If your surgery is close, the benefit may be less about building huge strength changes and more about building familiarity and confidence with the movements you'll be asked to do soon. Sometimes people start to worry that strengthening will wear down their knee faster, especially when surgery is coming up. And that concern makes sense, but the research on exercise in knee osteoarthritis does not support the idea that appropriate exercise accelerates joint damage. For most people, strength work is protective, not harmful, as long as it's dosed appropriately. Dosed well in real life usually looks like enough work to challenge the muscle without a flare that hangs around for days. If strength sessions consistently lead to a big spike in swelling or pain that lasts, it usually means the dose is too high, the timing is off, or the exercise choice needs to be changed. That's a great conversation to have with your physical therapist. One more thing that can help you set expectations. Even if you do excellent prehab, your quad will still feel different after surgery. Early weakness is common, and activation can be slower to return than you might expect. The point of prehab is not to prevent that. The point of prehab is to make you more prepared to work through it. One quick safety note: if you have sudden major swelling, redness, fever, or other symptoms that concern you before surgery, make sure you contact your provider. And before we wrap up, if you're listening and thinking, yep, that's me, make sure you're signed up for the Total Knee Success Insider newsletter. You'll get practical education that matches your phase of healing and helps you know what to expect. Click on the link in the show notes or go to totalkneesuccess.com. And if you want some extra support making sense of pain after surgery, my book, Making Sense of Pain After Knee Replacement, is on Amazon and Kindle. It's a practical guide to interpreting swelling, knee stiffness, soreness, and setbacks after surgery. And I'll link that in the show notes. In episode 81, we'll stay in prehab and shift the focus to low stamina, steps, pacing, and building capacity before surgery without lighting your knee up. Thanks for joining me. I'm Michelle, and this has been the Total Knee Success Podcast. This podcast is for educational purposes only. Discover more at totalkneesuccess.com and be sure to subscribe and share because every step forward takes you closer to living the life you love.